This activity is called the glute bridge. It is fantastic if your back is sore during your pregnancy, or if we're trying to rebuild your pelvic floor, or if the sacroiliac joints are just a little too loosey-goosey. What you're going to do is engage both your breath and your core and your pelvic floor and your hips in this activity. The first step to this is practicing your breath. You want to take a breath into your belly so it rises. And then when you exhale, you want to try to bring your belly button into your low back. If you're able to do that, then the next step is to take a nice breath in, breathe it all the way out, and then squeeze from your hips to raise them straight up so that your thighs are in line with your ribs. You're going to hold that exhale for the count of 4, and then come back down on the inhale. Take that inhale in, exhale it back out, raise the hips, and hold. 1, 2, 3, 4. Come back down, begin your inhale. And you'll repeat that about 10 times. There is an advanced version of this technique where once you get your hips all the way up, you straighten your leg. Usually we reserve that as a building technique for pelvic floor and core stability for our moms postpartum. A couple tips that might make this a little easier for you is to make sure that you're focused on having your heels as underneath your knees as you can to give you the best leverage. The other tips are, as you're squeezing your glutes, try to keep your core soft as you're compressing in, and try to also keep your jaw relaxed. We know that there's a relationship between jaw tension and pelvic floor tension, and what we'd really like to do is focus on a good amount of tone and not an over-tightening of those muscles.